located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics. And of course, we do encourage you to call in to join in. Today, I got a couple things to talk. I'm going to be talking about the soy dirty dozen. Anyway, there are 12 reasons why you should be avoiding soy. I'm going to read from the book that we discussed on Friday with Dr. David Brownstein. I've scoured the book from front to back. I found the 12 reasons. I'm going to pass them on to you. So in the course of our discussion today, I'm going to be able to bring you soy's true dirty dozen. Now, in the course of our conversation about soy or any other issue that's on your mind, you can open it up today. You can take over this show today by giving us a call at 412-825-6262. Soy-related, unrelated, it doesn't matter. Anything on your mind is okay with me. Just give us a call at that number, 412-825-6262. I'll wait for your knock on the door, and I will let you on in the store. Now, as the calendar is moving on, and we have now turned the page as of yesterday. I guess yesterday was All Souls Day. Huh? Today, we are going to be allowing you to come on in and take over, as I mentioned, on Friday. Now, interestingly enough, I have to journey to the state of New Jersey once again, but I always look forward to it because it's an opportunity to get with my good friends Patricia and Edward Kane, having another conference down there, and you always benefit from the conferences that I go to because I'll get a gem or I'll get a pearl and I'll bring it back to you, and I'll have it for you on Monday morning. In place of a live show, then on Friday, we're going to play a repeat show. It dates all the way back to September 12th, not too far in a distant past, but that interesting little devil, Konstantin Monastirski, was first with us on that day talking about fiber. Now, I know you remember the show. I'm sure that you're going to remember its repeat show. And, of course, we did many shows with Konstantin in the month of September. And I just heard from Konstantin by email. He's got a book in play. We're going to be bringing him back. But I thought it would be wise just to recover some old ground with Konstantin. And so we're going to be talking about the issue of fiber with him on a repeat show on Friday. That, of course, was from September 12th. Then, on Monday, we return back live. We're going to be with Roland Thomas. Roland, of course, is the interesting naturopathic physician who teamed up with a Soviet scientist by the name of Dr. Michael Kiriak. What came out of that relationship is the availability of a unique product. It is an all-inclusive product, every single thing you may need to get your day started with respect to, I don't know, how many supplements do you have on the breakfast nook table? I know that if you have a good regime, you have at least 6 of them. Now, how would you like to roll them up into one? And that's why I say that the F3, the bioengineered algae concentrate, in its most concentrated form, which is called F3, is exactly the way to accomplish that goal and objective. Now, it is such a potent substance that it can be used to help correct other medical issues that have been well established. One of them, evidently, we're going to be talking about that on Monday, is this issue with type 2 diabetes, an epidemic sweeping our nation for sure. We're going to be with Roland Thomas, and that discussion will take place on Monday the 7th. And on the 9th, Susan Smith-Jones, Dr. Vava Vavoom herself, with tips for those holidays. Now, yes, we have turned the page, so the holidays, the month of holidays is going to be beginning here with Thanksgiving right at the end, the 10 tips that she can give to you to help prevent weight gain over the holidays. Now, I'm sure that after I return from my conference in New Jersey, we'll have the opportunity to get Ed and Patricia and other people back on our agenda before the month of November is out. I do need to bring Ed Kane back. By the way, I get rumblings from patients who evidently are constant listeners to the KHB family throughout the entire day, obviously. One show after another, deals with health-related matters from a non-conventional viewpoint, from all sorts of realms of practitioners. And I'm told that the fish oil thing is out there in the radio, radiosphere, okay? So you're calling up shows, and I think you're still asking about, is fish oil harmful to you? And of course, I don't know how the hosts of the shows are handling that question, but before they tell you, it is harmful to you. And Ed Kane was the guy that brought us that entire message. I'll get Ed back for the science side, the academic side of this fish oil controversy once again, and plus anything else that may have come up new since we spoke to him last. So I promise you I'll get Ed Kane back, the maker of the 4-to-1 oil that is meant to replace that fish oil. So after you've completed your last round of fish oil, please replace it with 4-to-1, and 4 standing for the omega-6 component, the 1 standing for the omega-3 component. This ratio of 4-to-1 has been scientifically determined to be the correct ratio that you should be taking in your essential fatty acids every day. You might need much more omega-6s than you do omega-3s, and then they must be from the parent oil compound group. Not high up on the list, low on the list, ground-breaking list, the building block list. And in the case of omega-6s, we now know that to be things like sunflower, safflower, primrose oils. In the case of the omega-3s, we know that to be flaxseed, chia oil, that little thing sitting on the windowsill, a little dog, a chia thing. Must make one heck of an oil. Anyway, more on that as the month rolls on. Now, wanted to bring together, pull it all together with respect to the LDL issue. I know we talked about it on Friday. You had many questions about it. Sort of to put this to rest, let's take the final salient points. There is a new blood test that may or may not be making it to your local doctor's office. He has always ordered for you a blood test called the lipid panel. You know about this lipid panel because it seems like you can't go to your doctor's office without that being ordered. Of course, that is the old tried and true grouping of cholesterol, triglyceride, HDL, and LDL, and it is the #1 lab test that's requested by the conventional medical community. They have taken this one and run it into the ground. They have utilized this as the cardiovascular marker that is most important to be dealt with in order to correct your cardiovascular disease. Those of you who follow this show should know by now that it's completely absurd. It is way overplayed by the conventional medical community to the point that it's almost embarrassing to think that these learned individuals have bet the ranch on something that really hasn't come across with a payoff yet. Cardiovascular disease is out of control now, as it always has been. And we now have a new blood test that might be ordered. I say might be because the article of last week in the Tribune Review pointed out that the doctors are divided. This thing is now making its way across the country. Various practitioners and cardiologists are wondering, should we start ordering this new test called the LDL particle size? We've been ordering it for over a year and a half now. It's a very important lab from our perspective. But I would be quite concerned about even finding it to be ordered by your conventional doctor, and here is why. As of right now, the cholesterol story is dealt with by the statin drugs. And you should know that if your cholesterol level is elevated, and we're not even supposed to be treating cholesterol. The reason that the statin drugs were invented They were invented to handle an LDL problem. And of course, what they found out is they could not selectively lower LDL, so-called, which is erroneous, by the way. The so-called bad cholesterol. It actually isn't bad, but nonetheless, it's called the bad cholesterol. And by virtue of knowing that it has the potential to be harmful, this is what triggered the discovery and the use of the statin drugs way back in the late 1970s and early 1980s. That's how long these drugs have been in play. Now, they never selectively could lower LDL. And so what happened is by lowering an LDL, which, okay, seemed to be like a good idea, they absolutely completely lowered your total cholesterol, which wasn't a good idea at all, especially when you figure they had to change the numbers to even make it work, the normal cholesterol level being 250 to 300 milligrams percent. This is a unique number that most people, when they hear it, go, I never knew that. Well, you never knew it because your doctors had told you that the new number that they completely invented came out of the sky, came out of the clear blue sky. No rhyme or reason for coming up with a number is that you know it to be 200. And the statin wars began, and here we are now, many years later, embroiled in that controversy. And I think that this issue of the LDL particle size might be another crushing blow to your health. And here's why. LDL particle size is an important lab test when you know how to deal with it if it happens to be found in an injurious elevated level. Because of the various forms that LDL comes in, it's all based on size. And there's really large size LDL, and it just keeps working its way down until finally you get to the very smallest form of LDL. In fact, it's called small LDL, and that parameter has medical importance. And the reason that it does is that particle size is so small that it actually can work itself down in the cracks at the level of a cell membrane. Should that small LDL oxidize while lying in one of those cracks, the damage to the membrane can be devastating, cell death can occur, and obviously is harmful and injurious to have that happen at any great level. I can tell you that it has been so frequent now over this last year and a half where I've looked at a lipid panel that we've gotten on a particular patient, and all of those parameters are well within the normal range. I mean, cholesterol at or around 200, which is, I think, absolutely fine. Triglycerides, 60, 50, something like that. HDL, sometimes very high, 70s and 80s, sometimes mid-range, 50s. And then that LDL level below 100, which even the most aggressive of all conventional doctors would look at and say, hey, there's nothing to do here. Unfortunately for them, they can't help in any way. The person may have a very noteworthy history of cardiovascular disease, but because the lipid panel is ideal, is pristine, it is perfect, nothing seeming to get done by the doctor because they can't figure out what could be wrong here, or why is this person having such cardiovascular issues. So this is where I found the LDL particle size to be revealed as the possible link between what is apparently healthy cholesterol numbers, but they turn unhealthy once you get the LDL particle size and find that the small level is way out of proportion. To say a normal level is less than 527. That is the value. And I've had patients come in with 1,000, 2,000, 3,000 nanomoles per milliliter. That's the designation, which says we have a severe inflammation issue here. This, if that blood test wasn't used, could have never been detected. And of course, you cannot selectively lower, or you can't selectively lower LDL. You certainly can't selectively lower small LDL. So what do? What you do is what the conventional medical community can't quite swallow, which is you need to prevent that LDL from oxidizing. Therefore, you must use antioxidants This appears to be something that the conventional medical community gags and wrestles with because they can't quite understand why would taking an antioxidant be helpful here. Because they quite honestly don't know or appreciate the role that antioxidants can play. But if you can use the right amount of antioxidants, you can prevent any harm or damage or injury to the cell membrane from occurring at all through the use and the consumption of daily supplementation with high amounts of antioxidants. Of course, there are many out there, vitamin C just being one of them. You, of course, would know that it should be non-corn derived and should be fat soluble if you're going to get quite a lot of the milligramage in, because as a water soluble product it is not very absorbable at all. So, the title of the headlines of last week: Doctors, it went like this: Doctors divided over a new blood test. I don't know how the controversy is going to be resolved. Will the doctors out there actually order LDL particle size? It's still up for grabs. Is it an important blood test to get? Yes, but not necessarily in my opinion, and I see the problem on the horizon. Let's say that the conventional medical community actually begins to order this test, and it is learned that someone has an elevated level of this small LDL particle. Not knowing a thing about antioxidants and how it could benefit you, I feel that what's going to happen is that the doctors are going to start ordering and have another reason to pull upon the use of the statin drugs to drive those numbers down. They won't even care of how low the cholesterol, they don't care about it now, however low that the total cholesterol gets by virtue of the statins, they'll just say, well, the heck with it, we're trying to lower some harmful value here, and we're going to be using statin drugs to do it because that's all they know. So be very careful about how, if LDL testing is going to be done, LDL particle size testing, it's going to be done by your local doctor. If he decides that he wants to order it, and he can order it now, it's absolutely available to him, how he may resolve the issue would be the problem. And so, we'll now close out our discussion of the LDL particle size. You may have questions on it. You can call up to ask those questions. But with respect to doctors divided, I would say you want to know the outcome of an LDL particle size test. Everybody should get it. But then, once you have it, if there's a problem, the way it gets treated becomes the tricky issue. Okay, let's do this. Let's take a short break. And when we return, well, we have opened it up to you. The number 412-825-6262. Anything on your mind is okay with me. I'm going to be discussing the Dirty Dozen, soy's Dirty Dozen, 12 reasons to avoid the soy products. Be back in a moment.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry. I've got to go. Love you.
We can do this.
We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit's unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalogic minerals from the Dead Sea. With no added sugars, Fruit of the Spirit's unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show. We have no guest today. I guess I'm the guest, and I decided to pull a couple of things together for you. One, in a moment, I'm going to get into it. We're going to be talking about the book, The Soy Deception, crediting, obviously, the author, Dr. David Brownstein, who I admire tremendously. This book is available to you all via 2 ways. One, you can just go to drdavidbrownstein.com, or you can call, and this is that 800 number, 1-888-647-5616, and order the book, The Soy Deception. I'm going to go and describe the 12 salient reasons why you want to avoid soy, to sort of conclude this discussion on soy today, and of course allow you to come on in and set the agenda at any time on any matter, soy-related or not. And we do have a knock on the door right now. Let's let them in the store. Good morning and welcome. What's on your mind?
Good morning, Dr. Courtney.
Hi.
I talked to you Monday. I was going to see my new PCP yesterday.
Oh, yes. You said it was a female doctor, didn't you?
Yeah. I love to know what notes previous doctor put in her files, because this one came in like a bulldog.
Oh, you know what? Your other doctor probably mentioned that this is a very, let's say, inquisitive patient, or whatever other adjective may have been used to describe you.
Apparently she put in alternative naturopathic type beliefs, because that's where she came in. She says she first started off right off the bat. I don't believe in this, it don't work, so on and so forth. I showed her the blood labs I had from Dr. Kimenis' office, and she basically just said, well, get hold of the person who ordered the test and have that person go over them with you. Like, she couldn't interpret or didn't believe the values, the accuracy of the values, I guess.
Well, let's say that she couldn't interpret them was probably an accurate statement. By the way, these interesting blood work, because you got the Courtney panel drawn, right?
Yes.
And so you absolutely walked in holding those 10 lab tests in your hands, so significantly important. She knows and they know about every one of those 10, yet because they don't know what to do about any of them, except for the lipid panel, in which they use stat drugs, they just shy away. They are so timid to even move into the subject area because it's an area of impotence for them. It's inadequate. They can't discuss them and do something about them, so they tend to want to ignore them. It's a shame, but I'm listening. Yeah, I listen to you. You got the right balance. You need, and I say every patient needs to have their own family doctor, and even though that doctor may not be as well addressed to these points that we discussed here, you're the one that's aware of them. And someday, however, you might very well need, in an acute sense, all that medicine has to offer you. And if that should occur, that primary care physician of yours is going to hold the keys to the hospital in her hand and unlock the hospital and all of what's available there to you with the use of those keys. So you don't need to consult with those conventional doctors frequently. In fact, the majority of people that come to me say, I never go to that other doctor. I just have them there in case I should need them. And I think that's a wonderful way to utilize them. And that way you don't put them in embarrassing situations too frequently. Yesterday was embarrassing enough. She'll need much time to get over it. But I'd love to have read the notes that were passed on to her by your previous doctor that allowed her to take control of the situation from the beginning. So you felt like the game was rigged when you walked in the door, huh?
Oh, yes, from the opening salvo, yeah, because I told her this sounds like this is going to be a one-and-done visit.
Oh, okay, so you're going to fire her, or are you going to fire her?
Unfortunately, she's going to do a biopsy on something first, so
okay.
I got to keep her for... But I asked about the other doctors in the office. The nurses so important. They kind of said the other ones are the same way, so...
Yeah, well, you see, you're already utilizing the doctor for the reason that she can fulfill without a problem or challenge to her at all, and that would be if you do need biopsies done. By the way, what organ are we talking about? You need biopsies.
Actually, on my zipper line, I had like a sore red pimple erupted actually a month ago.
Okay.
Shrinking back, but it's red. It's hard nodule.
Okay, so there's a skin lesion here. Is that right?
It's right on my zipper line where
okay.
the surgery's done.
All right, so absolutely that needs to be checked on, and she'll do a wonderful job on that. And that's going to be her contribution for you right now. There'll be other needs of her help in the future. It's not her. Someone like her is going to have to fill that role, and just if you can get comfortable. I know that the best relationships I find when patients come to me is that a doctor who wants to know everything that's being done on the patient's behalf, yet just being made aware, it makes them feel comfortable enough so they're sort of involved in that way, but yet they say, just keep on doing what you're doing with Dr. Courtney or whoever the doctors are, and they don't get any more involved in just that. The awareness of what their patients is doing so that at least they can document it, and I think that's fair. If they're not comfortable enough to participate in the treatment management of these patients, at least to make them aware, and they don't get their feathers ruffled to find out the things that you were doing might not be something that they can't understand.
Yeah, I was kind of surprised because she glanced at all the labs, but then she said she'd never ordered these kind of tests for us, but then she made copies of them.
Well, I'm glad to hear she made copies, and she's so correct. She would never order a lot of those labs because without the ability to treat them, and that is the conundrum for the conventional doctor. They know of the hazard and harm to come from every one of those parameters. They are that educated. They understand what lipoprotein little a is. They know what homocysteine is in terms of being harmful to you. They can appreciate now this new lab, LDL particle size. Every single one of these shows up in their literature, yet because they have no medicine to correct them, they just don't order them. And that's why, in the way that we handle this, and I know your voice very well, and I know that you are on top of these things. You're going to have to do your own management on those with a doctor who will help you, and you know that to be me and doctors like me. And then just keep her clued in on whatever the heck she wants to know, and don't try to ruffle feathers if she doesn't want to know anything. Someday she may be able to help you again in an acute form of medicine, which is where we really shine. The conventional medical community is none better in an acute problem than it. So chronic problems, they're not very good with. Acute problems, they are excellent with. I hope you don't need them for their acute help, but unfortunately, statistically, sometime in the future you will, and you will need her or somebody like her.
Yeah, I mean, she says, she brought up the statin thing already, and she says, we're already butting heads here, and then she says, well, your blood pressure's elevated, I might need blood pressure medicine.
Well, you're probably a little upset just be putting in that situation. That's one of those situations where I have to rely much more, even when patients come here, on blood pressures that are taken at home than blood pressures that are taken here, because this white coat syndrome is a real thing, and if you're sitting in an uncomfortable situation, as that may have been for you, wondering how this new one's going to size you up, that could absolutely have affected your blood pressure. What's your blood pressure at home, by the way, just for the heck of it?
It's actually creeping up to the 130s over 80s. After my operations, it's been like in the 110s over 70s.
Okay, well, even at that, we're not in
like
danger levels yet, but nonetheless, there's a way to get control of this at this point, to drive it down so that blood pressure medicines aren't. I hope she isn't responding to 130 over 80.
Well, it is 160 over 90.
Yeah, well, yeah, but that was you sitting in her office looking at your file and reading about you from notes written by your previous doctor. The whole situation, I could see, would be very anxiety-provoking. But I thank you, and our listeners thank you, for sharing it with us, because every single one of our listeners might well be in the same spot, and maybe even are in the same spot today with their own doctors. So they can empathize with what you went through, and you say that you don't foresee a long relationship with this particular doctor. You think it may go by the boards rather quick?
I think so.
Well, keep on looking out there. When we meet one another, maybe we can talk about the area of the city you're in and some more friendlier doctors that I'm aware of in the area. That's the best I can do. Otherwise, we'll continue our work right here.
Oh, yeah, I mentioned to her about MCG testing.
Yeah, did she know anything about it yet?
Knew nothing about it. I kind of explained what it does. I said, like you said, there's an intravenous cardiologist who uses it. Her comeback was, well, they have fast CT scanning to do that.
Yeah.
I said, oh, yeah, you're small and full X-ray.
Yeah. They do have that fast, ultra-fast, called ultra-fast CT, but it really never caught on because the amount of radiation is so enormous that the public knew they didn't want any part of it. So they had this machinery, they developed it, a few hospitals in Pittsburgh got it, and then no one ever ordered it, and I don't hear of it being done too frequently anymore, simply because of the radiation exposure is so enormous that, and the score that you get is a calcium score that you then have to convert to something in the way that might reveal how much plaque you have. Anyway, it really is a technology that has fallen out of favor. MCG testing, so easy, so non-threatening, no risk factors. 6 minutes while lying on a bed is the way to go. And I know you're taking part in that particular thing. And there'll be a time in the near future, I think, where your doctor will become aware of MCG testing, maybe even begin to provide it. We were just on the cusp, right on the front end of this technology. Very fortunate for us. Love bringing it to you, and as long as we can stay on that front end, I'll be happy.
Yeah, she's a hard-nosed alliopath, I'll say that.
Well, she's got her antenna up for you. Anyway, however that relationship turns out, keep us informed. I guess I'm going to see you out at our Monroe office sometime in November. I'll be looking forward to further discussing this with you.
10 o'clock, Doc.
Okay.
Thank you.
Absolutely. There you go, folks. Can you empathize with that situation? Have you been in a similar situation? I just bet you have. We got another knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Yes, good morning, Doc. I have a lipoprotein particle profile.
Okay, LDL particle size.
Yes, that's what you've been talking about lately, right?
Yeah, who ordered it? Your doctor?
The doctor.
Oh, great. Okay, and
and it's a SpectraCell Laboratories. Are you familiar with that one?
Oh yeah, they're down in Texas. I'm very familiar with SpectraCell. And this doctor is cut above. To know about SpectraCell Labs tells me that this is a unique doctor, that's for sure. And what are the results, pray tell, with respect to small LDL? Do you see a value there for that? Did you find it?
Yes. My first question is, the one that you use, do they have a similar result page?
Well, I know if it looks rather busy, it looks congested with a whole bunch of different values, I'd have to say that seems like the one to me, because you got to pick out just one value. Out of all of those values on that page, there's only one that has clinical importance, and that's one marked small LDL. Did you find it?
Okay, yes, I do. Let me just say this first. It's broken down into three big categories, and you're right, this is a pretty extensive test.
That's right.
Category is the lipoprotein particle numbers.
That's right.
The second one is the biomarkers and risk factors, and the third is the lipid panel. Okay.
All right, so get that first, forget about the second two. Go to the first one, which you said, or the factors,
yes.
And look for small LDL and tell me what number you see there.
Okay, there's a small dense LDL3 and a small dense LDL4.
What's the value? And maybe I can make some sense of it.
Okay, those are both in the good range.
Okay, and by the way, do you have a number?
Yes.
What's the number?
The small LDL3 is 154.
And the other?
And the other is 58.
Okay. I'm not used to reading blood testing that has two different forms of LDL. Let's just say that the best I can do without looking at this head on is I know that a normal value for small LDL should be less than 527. If in fact this is that factor, and I can't say with a surety that it is, but if your 150 level, and it's certainly conceivable that 150 level is specifically designating the value for small LDL, then you're in good shape. Okay, you don't have to worry about it. All those other factors on that page, and you're right, it looks busy, are different sizes of LDL. By the way, it should say things like large and medium size, right? Don't they?
Those are the ones I wanted to ask you about next. Okay, so the two small ones are they have it in 3 color categories. The green range is normal, the yellow borderline, and red abnormal. The two smalls are in the middle of the green normal range.
Okay, that sounds fine to me. Now, all the other...
The large buoyant is into the red abnormal range.
Okay, but you need not worry about them. And here's why. They're so large that they can't get down in the cracks of a cell membrane that's been already previously damaged for there to even be a crack at the level of the cell membrane. So even though the numbers and amounts of each one of those other sizes might be disproportionate, there's no harm to come to you from that disproportionality. So I say to patients, don't get all worried and in a tizzy about any of those other values. You look at the general LDL number that is found in the lipid panel, that's cholesterol, triglyceride, HDL, and LDL. You check that number, and then the other number that you have to be checking is the small LDL, not worrying about the medium size or the large or the extra large. They are not damaging. The small LDL is the one that's damaging. Okay?
Now, the other one that I'm concerned about is the LPA is really high.
Whoa. Is it LP little a or LP big A? And I know...
That's under the biomarkers. That's the LPA.
Okay, and what's the value?
Okay, that value, the range is 6 to 29 is the reference value. Mine is 78.
Okay, well that's... Yeah, the normal values go up to 30, and that's where that 6 to 29 come in. So you'll need to do something about your lipoprotein little a. Your doctor, who knew enough to order this, is your doctor alternatively minded and able to deal with that lipoprotein little a? I would tell you that the way it needs to be treated, and please feel free to come on and see me so we can talk about this, is using lysine, proline, and ascorbate. LPA, lysine, proline, ascorbate in certain proportions should be able, over time at least, to bring that down below the 30 parameter. People who have elevated lipoprotein little a, as you do, that's a genetic issue. 40% of the population out there has this elevation, and it is injurious because it will inflame the lining of arteries, and that fire needs to be put out. So you got a good start. Please come on in to see us so we can talk about this face-to-face. I'm glad to see you got the labs already.
Can I ask a question with this here, the lipoprotein A?
Sure.
Okay, you're correct. It says it's highly associated with cardiovascular disease. This is from their vector cell clinical reference suggestions.
Okay.
It said LPA is an inherited trait that does not respond to diet, exercise, or statin drugs. Treatment for LPA is typically niacin. So is the niacin, the regular nicotinic acid, the best, or can you take that niacin inositol hexaniate?
Well, first of all, niacin probably isn't the way to lower it, as I've already said. And by the way, niacin not being a drug, I use frequently, but I use it to lower cholesterol, period. But when it comes to lipoprotein Lelay, this comes back to the days of Linus Pauling, who was the first to describe, and Matthias Raft has picked up with that treatment of using lysine, proline, and ascorbate. So we tend to differ on what that page may say to do versus what I do every day in my practice. Take my recommendation for what it's worth.
Oh, I've been taking the lysine proline for some strange reason. I knew about that, and I have Matthias Rath's books, and I've read about it. But just recently, the last couple of days, for some reason, I start doing the triple therapy there, the proline, lysine,
and ascorbic
acid.
Sure. Come on in so we can talk about it, sir.
Also,
okay.
I was on the high fish oil.
Well,
which I know better now from listening to Brian Peskin.
Oh, yeah, Peskin. Certainly he and Edward Kane. We know fish oils probably aren't the way to go there, and it would be a great transition if you move to the other forms of fats. 4-to-1 oil is probably the better way to handle it. Okay, sir? Come on in and see me so we can talk about it. I'll be looking forward to that. But hey, is he an educated listener or what? I love it when I hear they're out there doing the job as well as they are. And if I can help, please come in so we can kick off that relationship. I got another knock on the door. Come on in the store. Hello and welcome aboard. What is on your mind?
Hi, Dr. Courtney.
Oh, yeah.
I just had a comment for the callers ago, man.
Sure.
If he's looking for a more, holistic PCP, the home of Amy Stein, the Shadyside Holistic.
Oh, yeah, Dr.
They're so good. They will send or fax to you a copy of all the listing of doctors who are naturally oriented and at least open to holistic, ideas. So
that would be very helpful.
Yeah.
I'm glad to hear she put together a list. She's an institution out there in the Shadyside area. Squirrel Hill, I think, is where she really is. And of all these years, and admiring her as I have, I've never met the woman. Hopefully I will someday in the near future. Thanks for bringing that up.
Okay.
Absolutely. Wonderful. All right. As you can see, you can take over this show at any time. 412-825-6262 is the number. Let's take a short break. When we come back, the Dirty Dozen, folks. The 12 reasons to avoid soy as dictated by Dr. David Brownstein. Be back in a moment with the soy deception.
Healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call us now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, everybody. Welcome back once again to AM Impact on your health, heard here on KHB 620, each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show where we have opened it up to you. You're allowed to come and knock on the door at any time. Anything on your mind is okay with me. The number to do it is 412-825-6262. We do have a knock on the door. Come on the store. Hello, and welcome aboard. What is on your mind?
Good morning, Dr. Courtney.
Hi.
I spoke with you Monday about a high C-reactive protein number, and that you asked me about the SED rate.
Yes.
And then you mentioned a 10 Courtney panel.
Yeah. The Courtney panel is a set of blood work that we get in the offices of Dr. Oliver Caminos.
Okay.
In that Courtney panel, there are 10 blood tests which are associated with cardiovascular risk. And we refer to them as the entire panel as the Courtney panel. But those 10 blood tests turn out to be a basis by which we'll have future discussion when we look at what reasons that your C-reactive protein may be elevated. CRP is one of the 10. But unfortunately, CRP just lets us know whether or not there is inflammation in the system. It is not a parameter of inflammation itself. I call it a thermometer. It's like looking at a thermometer. And so looking at your blood work, we were able to determine that there is an elevation. It wasn't a major elevation, if I remember correctly. It was minimal, but nonetheless, there is heat in the system. There is inflammation in the system. We need to now find out what is causing that inflammation. And when we get the Courtney panel done, and we find out what the other 9 blood tests are, we'll be able to pinpoint exactly why your CRP is elevated. When we correct the reason for the elevation, the CRP will go down, and that will be our proof that we have conquered the problem and corrected it. Do I make myself clear?
Yes. And would the appointment be made with Dr. Caminos or through you?
Well, what we do is, and I should have already, if I didn't take the liberty, I was a little surprised. What we normally do is we arrange. Dr. Caminos comes to my office every 2 weeks, and so we normally just call right there while we're sitting with the patient. Did I not do that? Did I not call while we were sitting here talking to one another?
We weren't in your office. This was a phone call.
Oh, okay. I got you now. No, we need the workups that get done can get done in Monroeville, if you're closer to Monroeville, at his office out there, or in my office here. It consists of a lot of blood work that gets done. The 10 tests that you talk about are just part of that blood work. The entire Courtney panel has much more. Plus various studies like, echocardiogram, sonogram of the abdomen, Dopplers of the neck, the groin, the thigh, and then finally Dr. Caminos himself actually looks at that and has a short time to spend with you too. So all that needs to get done in a workup fashion in either one of the places. You'll just have to get signed up to have them done if you haven't done so already. And you can do that by calling me, and we'll arrange it, or you can call Dr. Caminos' office itself. The only thing you need to do is make certain that you identify yourself as a Dr. Courtney patient, because if you do not, you won't get the Courtney panel blood work done. He does not get that panel on his own patients. He only gets it on mine. Okay?
Yes, good. It
All right.
will be done.
Thank you.
Thank you.
Great question. Okay. Now, let's get through the Soy Dirty Dozen. I think to wrap this book up and make certain that you all can check it off your list, because we have 10 books to go through with Dr. David Brownstein, who will be back, by the way. I haven't mentioned it yet. He's going to be back the first Friday in December. Now, we don't know what book we're going to discuss. He said, why don't I pick one? And I'm going to pick one. But right now, on the one that we were discussing last week, entitled The Soy Deception, here are the points that I think need to be brought out to completely and correctly point out why soy is a harmful product. We've been doing this a lot, huh? talking about fish oil first, and we talked about fiber. Now, soy, thanks to Dr. David Brownstein. A couple points to make that were general points initially. This idea, number one, that somehow soy is healthy, and I think it's a common misconception out there. We think that soy would be wonderful to use, was the first mistake. It is not this wonderful product that we believe it to be. Certainly, it is not the healthy product that we believe it to be. Number two, it is a very plentiful product when you consider that with respect to American farming, the number one crop out there is corn, but close behind, not too far behind, soy is the number two. The third point to make is, if you're fortunate enough to find soy in a fermented form, if you can purchase fermented soy, don't have to worry about any of the points that I'm going to mention right now, because the fermentation process, the microorganisms that work and react with the soy end up removing all of these hazards from the product itself. The problem is that in the United States, 99% of all the soy is not fermented. It is non-fermented soy, which makes these dirty dozen all operational. If you're purchasing soy in the United States, you have to make certain that it is non-fermented. You better read the label and make certain that it is. Otherwise, this is what you're going to get. Here they come, the dirty dozen. Number one reason to avoid soy, and it is the reason why Dr. Brownstein actually stumbled across this item to begin with, was the relationship between soy and thyroid disease. And you should well know by now, Dr. Brownstein has been very much involved. We here at this office have been very much involved with treating thyroid problems. And as it turns out, non-fermented soy interferes with the conversion of T4, T3, and makes thyroid disease much more prevalent and prominent. Even in the case of a thyroid that's working, if you can't convert T4, which is not biologically active, to T3, which is biologically active, then in a sense, you don't have a functioning thyroid gland at all, when in fact, it might be putting out large amounts of T4. If it can't be converted to T3, it's ineffective. Another thyroid issue is that soy, number two, inhibits the uptake of iodine, which is absolutely important in thyroid disease or in thyroid functioning, because you must iodize the thyroid hormone to make it biologically active. So there's two conditions here that soy prevents: the biological activation of thyroid hormone, which was the tip-off to Dr. Brownstein that there was a problem with soy to begin with, and then to find out that these two are medically known would be absolutely great supportive information. The third of the dirty dozen, soy contains phytoestrogens. All that means is plant-derived estrogens. But we have a terrible problem in the United States. We have early exposure to soy products, meaning early exposure to estrogens. Our girls develop secondary sex characteristics at ages of 8 and 9 nowadays. And by the time menopause rolls around, we are so estrogen dominant that it takes years to get that turned around, because we should not be estrogen dominant into menopause. It should be that it's more progesterone dominant into menopause. And of course, all sorts of problems come from that estrogen over influence. Knock on the door. Huh? Come on in the store. Hello, and welcome aboard. What's on your mind?
Hey, good morning, Dr. Courtney.
Yes.
Hey, a couple things. Did I hear you mention Amy Stein?
Caller did.
Yeah. Well, Amy fell off the cliff. She died.
Oh, wait a minute. We're talking about not Amy Stein, huh? We're talking about You're right. I'm embarrassed. What's the gal's name in Squirrel Hill, who is the alternative doctor? Amy Stein is no longer with us.
Right.
Yeah. Good point. She had a terrible accident a couple of years ago.
Yes.
Falling off a cliff in West Virginia.
Right. So anyway,
hey, the name is Franny Perez. I was thinking.
Franny Perez, sure.
I was thinking about Franny Perez.
Yes.
Thank you for bringing that up, David.
Hey, I'm listening to your archives.
Okay.
And then just this past week, you had a caller that called you in last June and asked about Bragg's amino acids.
Yes.
Did I call?
Yes.
Anyway, that happens to be soy sauce.
Really?
Yes, that's all it is. It's a non-GMO soy sauce, but there's nothing about it being fermented, so it might still have. Everybody uses it as a health food. I know one of the big power foods was to take grated up beets and grated up carrots and to mix it with the Bragg's amino acids.
And that is a soy product, huh?
It's just basically tamari, like a soy sauce.
Wow. And that is non-fermented, and so everything that I mentioned is going to come with that particular product. There's where you go, where we're thinking that everything that's soy is healthy. And so they took the GMO component, and they're raising without pesticides, sprayed on the stuff. Nonetheless, all the other stuff comes with it. Good point, David. Thank you for bringing that to our attention.
You bet.
Okay.
I'll talk with you soon.
Okay. All right, we're going to get up through this list. Let's move on quickly. I'm going to do it as quickly as I can. There are phytates in soy, and these prevent minerals from being assimilated. A number 5 reason that you want to avoid soy is that soy has been shown to increase the body's requirement for vitamin D. The number 6 in the Dirty Dozen. It's been long recognized that soy consumption can cause vitamin B12 deficiency. Number 8 from the Dirty Dozen of reasons to avoid soy. During the processing of soy, highly carcinogenic nitrates and toxins called lysinoalanines are formed. Number 8, it's genetically modified, folks. Number 9, it's the highest sprayed pesticide crop in the country. 10, it's allergenic. 11, it contains saponins. And 12, it has protease inhibitors that prevent the breakdown of proteins in digestion. There's your Dirty Dozen. Have a wonderful day. I'll see you on Monday, Friday repeat show with Constantine. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on your health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 30